Hello, my name is Amanda Perez, and I am recording this video for an assignment for Palm Beach State College. This video is for learning purposes only. Today we're going to be performing a head-to-toe examination on our patient, the teddy bear. Before, we're going to pretend that we're doing a well visit on a patient in an hospital. So what we're going to do is we're going to knock on our imaginary exam room, introduce ourselves to the teddy bear patient, let them know my name is Amanda Perez, I am a registered nurse, and I'm going to be doing a head-to-toe assessment. Make sure that before you start your assessment that you provide for privacy and that you perform hand hygiene. Then you're going to want to correctly identify your patient, depending on your hospital policy, using 2 patient identifiers and verifying that against the patient's name band. Today I'm going to ask the patient to please tell me his name and date of birth. I'm going to assume that the teddy bear got the questions right and that he's wearing the correct name band, and we can go ahead and proceed. Explain to the patient that you're going to be doing a minimally invasive head-to-toe examination, and let them know that if at any point during the procedure they have any questions or they feel uncomfortable, they can of course pause you. Make sure that you've provided for privacy by only exposing the body part that you're currently examining, and that you shut the curtain and that you've shut the door. Then what you're going to do is you're going to go ahead and start your assessment by assessing vital signs, temperature, pulse, respirations, blood pressure, pulse ox, and pain scales. Make sure that everything falls within the normal limit. If the patient does report pain, you're going to go ahead and do a full pain assessment by asking the patient where the pain is on a scale of 0 to 10. How bad is the pain? Does the pain radiate anywhere? Can you please use a word to describe the pain to me? If they can't describe it to you, then you can help them out by offering some suggestions. Is it burning? Is it stabbing? Is it aching? Ask the patient, does the pain come and go, or is it continuous? When did it start? And does anything make the pain better, or does anything make the pain worse? Then after you've completed your vital signs and you made sure that everything is within normal limits and you've addressed anything that you have to address at that point, you move on to a general survey. What's the patient's general appearance? Are they in any apparent distress? Are they happy? What's their behavior? Are they calm and cooperative? Assuming that the patient is in no apparent distress, calm and cooperative, you'll move on to the next part of your assessment, which will be the skin. Let the patient know that you're about to assess the skin for turgor by gently pinching above their breastbone, noting for any signs of tenting. You're going to also assess the color of the skin. Is it pink? And the temperature, is it warm? And the moisture, is it diaphoretic, or is it pink, warm, and dry? Next, we're going to assess the head. You're going to examine the patient's hair, looking for any lice or bugs that shouldn't be there. Make sure the scalp is clean. You can palpate the cranium to make sure that there's no lumps or scarring. And then you're going to go ahead and assess the temporal arteries above, right here at the temples, bilaterally, making sure that they're even. Next, we're going to assess the mouth and throat. Using a tongue depressor, you're going to have the patient stick their tongue out and say, ah. That way you can check the lips, make sure that they're dry. The mucous membranes, make sure that they're intact and that they're moist. The tongue, make sure that it's the proper color. And the tonsils, to make sure that they're not swollen. And the uvula, to make sure that the patient has no trouble. Ask the patient if they have any trouble swallowing. The next part of our head-to-toe assessment will be to assess the eyes. We're going to check color, moisture, conjunctiva, make sure that everything is clear, that there's no discharge, nothing that the patient's complaining about in that area. Then you'll also check the sclera, the pupils, and you want to check the conjunctiva by pulling down and checking the color of the inside, making sure that it's not pale. And you'll also check the patient for the blinking reflex and make sure that the cornea, protecting the cornea. Next, you're going to check their ears. You're going to externally check their ears, ask them if they've had any problem hearing, noting you're going to check externally, making sure that there's no anything that should not be in the ears, no foreign objects is what I meant to say. And then you're going to use the otoscope to look into the patient's ear and check the tympanic membrane and make sure that it is pearly gray and intact. Next, we're going to be assessing the nose and sinuses. Check externally, ask the patient if they're having any sinus symptoms, if they're having any problems in this area. Check the mucosa and the nares, make sure that the mucous membranes are moist and intact. Check the septum to make sure it's not deviated. And palpate the sinuses, the maxillary and the frontal sinuses to make sure the patient's not having any pain in those areas. Moving in an orderly fashion, we're going to go from the head to the neck. You're going to check the neck for symmetry, make sure that the trachea is midline. You'll palpate the carotid arteries. and you'll visualize them to make sure you don't see anything out of normal. And then you'll check the jugular veins, make sure that they're not too flat or too distended, because those are all signs of congested heart failure or fluid overload or dehydration. Next, you continue palpating your lymph nodes. You're going to check the supraclavicular nodes and the range of motion of the neck, asking the patient to touch their ear from side to side and roll their head around and make sure that they're not having any pain in that area. Next, we're going to do a neurological assessment by checking the patient's mental status. Are they awake? Are they alert? Are they oriented to person, pace, and time? Then you're going to also check the cranial nerves by using the pen. You're going to have the patient ask the patient to keep their eyes on their pen and moving their eyes only, not their neck, to keep their eyes on the pen while you move it up and out, straight, midline and out, down and out, back to the middle. Again, up and out, midline, down and out. Make sure that the patient can follow the pen that assesses that their cranial nerves are all intact. Next, we're going to move on to the upper extremities. We're going to be checking for circulation by palpating the radial pulse, movement by asking the patients to lift their arms up and out, make sure that they have full range of motion and movement. Make sure that ask the patient if they're having any problems with sensation in their upper extremities, any tingling, numbness. Then you're going to check the cap refill, which also helps check circulation by pushing down on the patient's nail bed and checking to see how fast it blanches back up again, that it pinks back up. It should be less than 3 seconds normally. You're going to check muscle strength by having the patient push against gravity and making sure that they have proper muscle strength, and a range of motion by having the patient move their little arms all around. Next, we're going to visually inspect the anterior thorax. We're looking for the shape, making sure they're not barrel-chested, that their trunk is a good shape. Movement, any retractions, substernal retractions, any problems breathing. The skin, make sure that the skin on the chest is normal, that the nipples are midline, that there's no discharge, and that you can go ahead and palpate the axillary nodes while you're assessing their breasts on their thorax. Breathing, make sure you're checking their breathing movements, and then you can go ahead and listen to the lung sounds by using your stethoscope. In an orderly fashion, every time you put the stethoscope on one side, you're going to put it on the other, back and forth, asking the patient to take a deep breath for you, taking care to listen to the right middle lobe as well. And you want to make sure that the lung sounds are clear bilaterally and that there's no adventitious lung sounds. After you do that, you can check the precordium and then listen to heart rhythm. You're listening to the heart, and you want to make sure that you're listening for S1 and S2 and that you don't hear any murmurs or extra heart sounds. You can percuss the anterior chest, let the patient know what you're doing, listening for any hollowness or any sorry. And then you can go ahead and palpate the carotid artery. Then we're gonna after we've done the chest assessment, we're gonna assist the patient to lie down so we can assess the abdomen. You're going to visually inspect the abdomen, making sure that you don't see any obvious herniation, that the umbilicus is midline. Ask the patient if they're having any pain. Explain to the patient that we're going to first listen to the bowel sounds. What you're doing here is that you're listening for bowel sounds in all 4 quadrants. You want to make sure that you listen for a full 5 to 15 seconds before you say that there's no bowel sounds in that area whatsoever. You can listen to the, flip your stethoscope around so you can listen to the arteries, the renal and the iliac arteries, and then you can listen over the liver and the spleen, making sure that you do not hear any friction rubs. After you do that, you're going to assess the pulses in the abdomen like we did when we listened over the arteries. Make sure that the then we're going to go ahead and move on to the next step in our abdominal assessment, which is percussion. Using your non-dominant hand, you're going to lay your hand flat on the patient's belly and then lightly strike in an orderly fashion in all 4 quadrants, making sure that you hear, you should hear resonant sounds over most of the abdomen, and you expect to hear dullness over the liver and the spleen. Next, you'll palpate the abdomen. You'll let the patient know that, to let you know that if they're having any pain or tenderness in that area. You'll start in an orderly fashion, right lower quadrant, right upper, left lower, and you're feeling for pain, tenderness, or lumps that should not be there. After you do that, you're going to palpate the abdomen. You can do light circular movements, and then you can ask a patient to sit up, so you can use deep palpation, so you can have them take in a deep breath and then breathe out, so you can feel the liver and the spleen. And you can also check the kidneys while they're sitting up to check the angle of the CBA. You'll place your non-dominant hand on the patient's body and you'll lightly strike it, checking for any tenderness over that area. After you've done your abdominal assessment, you can ask the patient if they have any urinary symptoms, and if they have, when their last bowel movement was it regular, if there's been any change in bowel or bladder habits. Next, after we've done the abdomen, we're going to move on to the lower extremities. Check the skin on the lower extremities. Are their legs shiny and hairless, or do they have any signs of psoriasis? Does the skin look normal to you? Check the toenails for any fungus. You can also check for capillary refills on the toenails. Check for any signs of edema. If you do see any swelling, you can push it in and let it go. See how fast it takes for the edema to come back up. Check full range of motion in the legs. You could ask the patient to move their legs around you. You need to check strength by asking the patient to push against gravity to see how strong it is. And then you'll check reflexes. Using a reflex hammer, you can check the patellar reflex by lightly striking just below the kneecap and making sure that their reflex is good. Next, we're going to do the posterior thorax, which will be the back. Check the thyroid. Ask the patient to swallow. Make sure that the thyroid is midline, that there's no lumps. The skin is normal. There's symmetry. You can palpate over the spine and the scapula. Make sure there's. You can check their buttocks for any signs of diaper rash or pain. Ask them if they've had it. You don't have to do a. You can do a rectal assessment at this point if the patient has any complaints. You can check for any hemorrhoids and bleeding. And of course, we've already listened to the breath sounds on the posterior thorax by listening when we were listening to the lungs. Then we're going to check the genitalia. While we're already at the bottom, you're going to check the perineum, make sure that it's clean, that there's no tenderness, the rectum is intact, and that there's no signs of herniation. Finally, you will document your findings. If there's anything abnormal, you'll make sure to address that with the physician. Ask the patient if they have any questions regarding their physical examination, and if they don't, you can wash your hands. Make sure you check the room for safety. Make sure that the call bell is near and that there's nothing that the patient can trip over. Ask them if there's anything else you can do for them, and if not, you've completed your head-to-toe assessment. Thank you.